They are medical tests and services you and your loved ones may have taken recently, but some big changes are coming to these OHIP insured services after months and months of back and forth. And with the help of an arbitrator, the Ontario Medical Association and the province have agreed on 11 recommendations that could change your medical visits. The changes are split up in two categories: improving patient care and reducing unnecessary services, put forward by a working group established by the arbitrator earlier this year. The province saying these changes will save $83 million.
It's reducing unnecessary tests and creating new capacity. It's making more time in people's days to see the right type of patients and allowing people to move through the system faster, and making sure that the care they do get when they're in the system is the right care and not unnecessary or even potentially harmful.
So going forward, you no longer will be required to see your family doctor to get a referral to a specialist who you've seen before for the same problem. Essentially, this will be cutting out the middleman. Now you'll have access to that specialist within a 2-year period, simplifying the process and allowing your primary care provider to focus on other patients who may need their time. So the changes will also see reduced CT, MRI tests, and surgical consultations for arthritic care. Instead, physicians will be encouraged to refer these patients to specialized clinics instead. And when it comes to physicians making house calls, there will be a tighter criteria for patients. Those who aren't considered frail, elderly, or housebound can be seen in their doctor's office. So the premiums for those who fit in this category will continue to be covered.
For many of these, we will be able to get data. Because these are things that are registered through the system, and we will be able over time to take a look at what the impact are, and also to make sure that there's nothing unintended and to course correct if needed.
One last thing also, if you are used to getting earwax removal from your doctor, this will now be required for you to pay for the service if it's not medically necessary. So what does that mean? That means if you're not having trouble hearing, or if over-the-counter treatments like oil and water have not worked, then you will be able to get this treatment covered for you. For a full list of all 11 recommendations and more details on this, you can head to our website, citynews.ca.